you added your personal journey and that. And picking up on the last point you mentioned, that on this time of the pandemic and where the money is going now and where politics is going and where the niche is going. So that's take us to our next speaker on a very niche field, which is health diplomacy. And health diplomacy is the same as was you explained, as that's where now politics is talking about and where the money is going into health. And this is a necessary field for international cooperation in pandemics like that. And so with that, I have a pleasure to introduce our next speaker, who's Jasna Karacic, Head of Patients' Rights Unit of UNESCO Chair in Bioethics and Health Diplomacy Experts, International Council of the Patients Ombudsman. Jasna, thank you very much for joining us. It's a pleasure to have you. It's a very interesting time. It's very field is very rich and very important for as a career path, but also as a field of international cooperation and diplomacy. So Jasna, the floor is yours.
Thank you very much. Hello to everyone, and thank you really for the invitation. I'm Jasna Karacic, health diplomacy expert from International Council of the Patient Ombudsman, and I'm head of patient rights unit of the UNESCO Chair in Evidence-Based Medicine. And you will see why this is important in a situation with the COVID, of course. I will present global health diplomacy. And let's start. To understand better global health diplomacy, I use two different approaches. With focus, first, a diplomatic career in the health, and second, a university career in health diplomacy. To better understand, because it's not easy to understand what is a global health diplomacy, I will define world health coverage, what is an effective implement for achieving health as a fundamental human right, but depend on countries' governments and insurance proposed on the alarming level of disease severity. The novel coronavirus pandemic is upending healthcare as a business, profession, and human relationship, and the possibility that other viruses will represent a world threat soon looks very, very real. So, what is then global health diplomacy? This is a novel specialty with a concept in health and medicine as focusing on the priorities for bettering international relations in foreign affairs. It has recently been embraced as an academic research, what is also important topic, and foreign policy focus area. Despite being carried out for over 150 years, acquires the term is relatively new. Although there is a lot of dialogue about the global health degree, a number of definitions and concepts that define this practice remain unclear. So we have actors in the global health diplomacy. From the top, there are health attaché and diplomats. Definition is interaction and negotiations among governments and state actors. In tools, bilateral and multilateral treaties and agreements among government and state actors. Then we have a government agency and multilateral institutional representatives. This is most known as a like stakeholders, global health diplomacy. In definition, it also interactions and negotiations among states and multilateral actors, but with tools, partnerships among government agencies and multilateral institutions. And then we have also actors. This is a host country officials, non-governmental organizations, universities, private enterprise, and the public, and of course, hospitals, what we will see later. This is an informal global health diplomacy with interactions among public health sectors and their counterparts in the field, and with tools agreements with private fundings, academic and humanitarian agencies. So we can see here how is important communication between all these parties. So, of course, that coronavirus is now in the focus, but we must not forget HIV and Ebola as well, what was the first sign of health diplomacy in the world. So the coronavirus pandemic is a good example of the importance of health diplomacy and foreign affairs when it is necessary to coordinate all states to provide a rapid response to the crisis and action taken around the world. However, the shortage of formal conceptual framework for the field of global health diplomacy and undefined job description for a health diplomat calls for more information from those who practice diplomacy in this space, because we know up to date that we don't have a special training in health diplomacy, what I think that is very, very important. Health is one of the core components on development, and the international health cooperation remains one of the unifying forces and a solid reference point for delivering fair health and social outcomes. Health diplomacy's core goals include more equitable improvement in populations' health and well-being. This was exemplified by 2 years process that developed the Health 2020, the European policy framework and strategy for 21st century, which put health equity at its center. It also resonates through the United Nations 2030 Agenda for Sustainable Development and Sustainable Development Goals. And of course, from United States, we have a complex view of health diplomacy in the health impacts and include transparency, clearly defined goals, real need, visible impacts, global goals, for local focus, then long-term commitment and capacity building. And in the center of this is public opinion, very important, then governance, stability, and civil society empowerment, diplomatic engagement, and socioeconomic development. Today, health diplomacy is critical to lead us through a period of considerable uncertainty in Europe and the wider world. In the World Health Organization, much of health diplomacy deals with the health challenges during the meetings and other high-level events. Today, health problems are very, very complex, and these meetings have become increasingly important over recent decades. Delegations face extensive and complicated agendas, often having a political nature and requiring intensive preparation and significant intersectoral consultation. Public health professionals increasingly need a better understanding of the mechanism of diplomacy, and diplomats engaged in health-related negotiation must be informed of the challenging dimensions of today's public health. Obviously, that we need a strong health diplomacy now in this moment more than ever, because health diplomacy engages all branches of government and non-state actors to find solutions to the health problems. There is an example of vaccination. In the negotiation process, the member states tell the Commission how much of the vaccine they want to order in Europe, but they are then responsible for purchasing the vaccines when they become available, once they prove to be safe and effective. The Commission does not sign contracts for deliveries to individual countries. So we can see here that is every country is responsible to protect their citizen and to ensure the best quality to get a vaccine. So now in the media we can see the criticism about reactions of some countries, and that we have some kind of discrimination. So that is a health diplomacy to resolve that problem, because if we have a requesting vaccine as first, then we need to approve this request, and of course we have a requesting against allocation of the vaccines. Then second issue is COVID-19 passports. So because the tourism ministers meet at EU level, want to define what is a special COVID passport plan to open borders due to Corona. Of course, that this is a question what may be useful and help to people to travel, to be safe in the some borders and everything. But in the moment when we don't have access to the vaccine to all people without discrimination, then we can say that this situation can be discriminated by some people for traveling. Obviously, in the health diplomacy center is always a patient and a healthcare system to provide everything to the patient. And patients are in the center from World Health Organization, from the healthcare system, hospitals, for example, European Medicine Agency, research departments, and government, if it's their EU or some other, or United States, or any country. I mentioned before why it's important to have a university background in the health diplomacy and to work as a researcher in health diplomacy to understand all. Now you can see why is this important and complex to get all together. Because we deal with the hospital lockdown, especially last year in the beginning of pandemic that was present in over the world. And what does that mean for inadequate access to the healthcare? What we had, the patient management during the COVID-19 has laid bare long ignored risk, including inadequate health systems, gaps in social protection, and structural inequalities. Therefore, the importance of basic public health shows the crucial strong health system and emergency preparedness. Worldwide health authorities put hospitals on lockdown by providing only emergency treatment and surgery. Up to date, doctors dealing with the dilemmas of providing or postponing the already scheduled process with decision depends on the actual situation in the hospitals. And then it's not explicit, the guidelines process, but could be scaring, and perhaps it's because they don't know what to do as a health crisis put in the shadow of non-COVID-19 patients. So there is a global health diplomacy that need to help the health professionals to dealing with that. Patients are faced with a highly controversial interventions in their treatment, and also accomplishing restrictions in visiting dying relatives, force the basic rights severely to be impaired. Furthermore, we call attention to the legitimate concerns regarding potential for the violation of patients' rights, because these protections should be always the first point out. Don't forget that is a right to healthcare is a fundamental human right. Do we have a fair that we have a sufficient capacity in the world's hospital? That is also a question for health diplomacy, because during the initial wave of COVID-19 pandemic, hospitals worldwide diverted resources from routine inpatient critical care and outpatient clinic to meet the surge in demand. The COVID-19 might be affecting the hospitals for the next years, so sustainable development must go behind the national strategies, calls to take urgent action to stop the spread of the virus and avoid the potential risk of increasing deaths of other diseases. International Council of the Patient Ombudsman has a strong consensus for improvement in communication to follow universal source control by diplomatic relations to providing non-COVID-19 clinical care during the pandemic. Why? Because the outcome of limitation in access to the health care to protect patients remains unclear. We need to take care about patient safety, especially if we have chronic disease patients, and from the other side, from the patient safety regards to vaccine. Principally is to adopt and provide the necessary in-person clinical services for conditions other than COVID-19 in the safest way possible, minimizing disease transmission to patients, since no evidence that lesions in diagnostic and therapeutic process show effectiveness in stopping the spread of the SARS-CoV-2 virus. The impact of the COVID-19 outbreak has raised significant concerns for patients. Moreover, increased the number of queries from the health and social care organization regarding specific patient rights they are treating and carrying on. So, to back to the right to the integrity of the person in bioethics, most importantly, it should not come down to choice between COVID-19 treatments or cancer treatments or any other chronic disease, because both diseases should receive the same attention. The healthcare system should be reaching a point in which it can be able to treat all disease. On the front line, the COVID-19 evokes anxieties and fears and more than ever before, health professionals need to protect and defend the fundamental rights and safety of their patients now. It's not possible to accept a new normal situation only by treating a patient with the suspected coronavirus. Finally, we need to find the best response of the hospital care management without allocating other important disease and keep the patients informed on their risk and the needs of certain medical behavior. Now we can see some improvement in some countries in this year regarding last year, but the many countries are still in hospital lockdown. For the end, also what I think that is important to discuss and very important to see difference between the countries is that we need to understand better the tracking statistic so that we clearly see how patients we affected in relation to their non-COVID health problems. Currently, we see many different numbers, and it's not clear whether deaths are due to COVID-19 or deaths are occurred with not directly from COVID-19. This statistic must be clearly shown. Figuratively, if you are shot, did you die from the gunshot or died with the bullet? So I think that this is something what we need to discuss without any doubts and provide information to all countries in not focused on the Europe in the all the world, because to fight with that with the COVID we need to have all complex system, all countries together without discrimination, and of course we need to learn something from that. If we are already in all these problems, we need a strong health diplomacy. We need to learn everything from our mistakes for the future. That's all for me. Thank you very much. This is also email if you want to send a message every time, or you can ask now. Thank you very much.
Thank you, Jasna. Thank you. It was very interesting to listen to your presentation and your expertise. So I'll wait for if there is any question, but I have a couple of questions myself. So for the field of health diplomacy, so how participants or audience are listening can build expertise to become health diplomats, or they become experts in health engagement at a diplomatic level? So what kind of expertise or what kind of experiences they will need to gather to become to excel in this role?
Okay, so the health diplomats are health attaché. They are delegated from their country. They're representatives of the countries and delegated to, for example, European Union or European representatives, and they made negotiations in the Council of the European Union. So that is a position from the ministries who send their experts in health diplomacy to practice health diplomacy. But what is my idea? My idea was to improve the skills what health attaché needs to have, and that is something what I am doing now with my colleagues to improve the skills, because I didn't find in over the world that there exists special training for practicing global health diplomacy, and there is no training what is enough to do all of these things. That is why I put together university research and the practicing research in diplomacy, because for the moment these two things need to be completed together. That is possible to understand the importance in this crisis, because we're talking about people's lives. So it's not easy to have just one thing. But what I saw, what is a very interesting in Switzerland, they have some program for the in health politics and health diplomacy, and there is some training what can be very, very helpful to practice in health diplomacy. But definitely we need here establish very important as master or something like that, what I have in plan to organize with my colleagues, because I think today that is a very important to have that skills, because it is a specific topic, but we can be part of the community who can decide something what can help to save lives.
Thank you, thank you. So there are some couple of questions from participants, but I just want to follow up on your answer. I know actually there are some embassies that I know here in London, they have like a health department or health section. The kind of work they pursue, my understanding, is similar to consular work, because what they have is they arrange the health visits of their citizens who come and for who have a health, who they receive a health service here in London or the UK. So I don't think this is more like a consular service rather than a diplomatic interaction with the other countries or other engagements. So the way that you describe it is not so prominent or not as known as. So how can embassies or ministries can combine between that type of work, which is a health section that they have in embassies in charge of their citizens that they come to receive a health they do a health service in the receiving country, and the thing that the health diplomacy, which is engagement of other countries on the health matters?
Yes, the embassies are responsible for the position of the diplomats who are responsible for the health topics for discussions. But it's not only embassies, because health diplomats need to collaborate with the World Health Organization. Then is if we focus on Europe, there is a European Medicine Agency. There is a United Nations Center, what is also responsible one part. Then we have a drugs community. We have a lot of parts. Then is a second national expert who can work with the Innovative Medicine Agency. There is a lot of position with the health diplomacy, but we can say that World Health Organization is absolutely top of this health politics and health diplomacy, and for decision what every country, every embassy need to follow, and that is also can be questioned because it's not strictly it is just a recommendation, or it's just something what we strictly need to follow as every country has their representatives. But decision, what is decision-making process is absolutely negotiations between all countries and between all health attaché from all countries.
Thank you. Well, thank you. They're really impressed and I really enjoyed listening to your model. So what you're presenting is a model of how health diplomacy should be pursued at the multilateral level. And so, yeah, I have a question here from Lisa Vickers. Could you speak more about how your role in academia interacts with your UNESCO role? Are you employed by your university, UNESCO, or both? Would you recommend of those of us earning a PhD to seek academic employment to break into a humanitarian sector?
Mm-hmm. Yes. The UNESCO chair is bioethics is academic field, academic departments, and include more than 250 departments over the world. And I'm head of one of that. This is from the patient rights unit. And we're dealing exactly with that, with the human rights in medicine, diplomatic answer, global health challenges, according to the patients as a human rights. And yes, the question was about the employment. This is not this is voluntary work in the research academic, and for obtaining a PhD, because I'm doing PhD research in this topic from the UNESCO chair for bioethics and health diplomacy related to the human rights. So this is absolutely important, and if you will have more questions regarding this, you can send me email. I will try to answer more details, how to engage and how to do some things with the UNESCO chair in bioethics.
Okay, so the question here from Amanda Bishop, I try to actually just rephrase the question. So to work in health diplomacy, is it more appropriate to be a health practitioner like a doctor or a nurse, or to be a diplomat and learn about the health sector, or something else?
It is very important that it's necessary to have a university degree, maximum university degree, and there is also good to have a medical education, because it can be very useful, but it depends on the countries and their needs. Sometimes they have more politicians there and the humanitarian science to practice, and then there is a shortage of this medical education and health diplomacy education, what I mentioned before. But it's not explicit which kind of the health attaché is background. But absolutely, from my opinion, it needs to be connected with the medical study, and then diplomatic school, because this practice showed the best outcome of the understanding of the health diplomacy.
Thank you. Do you have in mind any country like that are the exemplary model for health diplomacy? And if you can share why is that?
Okay. Yes, during our presidency of the Council of the European Union, I saw that European countries has good regulated the positions of the health attaché. And what I saw, like a good experience, Finland, they have health attaché, they are covered with the Ministry of Health persons, and also from the political science, and they show a very, very good example of the health diplomacy. But as well, Croatia, from where I am, also we have this kind of the job who dealing with the health issues, and before COVID as well. So we was prepared to do COVID during our presidency on the Council of the EU, because we had the COVID in the beginning of our presidency. And what I can say that absolutely it was a very good example how to deal with the crisis in the health. And we learned a lot from this situation, and now we are ready absolutely for everything.
Thank you. Thank you. So what kind of skills or trainings that a health diplomat should pursue to pursue a career as a health diplomat? What do you suggest as skills and training they should take?
So ability for negotiations absolutely is must have. But there is also one thing what I consider to be the most important, that is critical thinking. Because if you read some paper, then you need to check every single word. There is not something to read the one paper. You need to check absolutely everything, because the problems occurred always in the one word what is inside. So critical thinking is absolutely must have. You need to check every word and see all possible opinions of that word, and then to be very, very you need to take care about what you say in the public, in the every situation. But the best for all is that you need to have enough knowledge of all of that, because if you are safe, that you are covered with all knowledge what you can have, then you don't have problems with dealing with some questions from some other countries and some issues what you have on your work. So absolutely, the skills are negotiations, to ability to be good communicator, and respect to others, other cultures, other countries, and other people. So that's what I think that is most important.
Thank you, Jasna. So can you tell us more about your career journey? So how and also what draws your interest to this specific field?
Okay, I start very early as a university researcher on medical school and forensic science. I start to see a health system from the more approach different from classic health, and then I start to make research about healthcare policy, and patient complaints for the system, and healthcare politics. Then I start to see difference between all the countries, first from the Europe, then from over the world. Then I start to see what is a public health and what is the private healthcare system, and to compare all of these things, and how the politics can help to ensure that every patient will be covered with the insurance and with their rights. And then when I saw when I made the analysis of the all complaints from the patients, so then I had a very clear very clear picture about all of that, what's happened. And then I started to do health diplomacy. Then I found the association for the education for the health diplomacy and the health politics, and to do research with the other university, to connect all university who has an interest to be in this process. And now my last research, what is from my PhD, is about how nations, how governments are reacted to the crisis. So I will compare all the world reactions and the criticism of the in the view of the experts in health diplomacy over the world. So I think that can be very useful after publishing to share with the community, to learn something from that, and to be prepared for a new situation, because I'm worried that this is not only crisis in the early future. And then when Croatia starts to have a presidency in the Council of the EU, what was last year, then I was delegated from the Ministry of Health to do that. I was responsible for the medical cannabis, and it was very, very interesting to see difference, to speak with other opinions, to have other opinion, to check every possibilities, to critical think about all. And that was very, very interesting. But of course, I have a very passion to do that. It's not just my job. I really enjoying to practice in diplomatic career in health, to do research, and what is the most important this career, to be connected with over the world. And what I can make as advice to our participants: send emails every day. If you see the person, if you see someone who think you can help you to give you some information, just send the mails. Because of my beginning, what you asked me, I can remember that as a student, I sent every day about 20 mails was sent from my computer. So every day every day is here to learn something, and never it's important to never think that you know everything. So because every day when I learn something, I can see what I don't know and what I need to learn. and that is some challenge, especially in the health. So I think that this is something what is really challenge for me, and I really enjoying that. And so practically 24 hours you are on the table, because it's important also to have a fast response for every questions, to be up to date.
Thank you, Jasna. Another question is, so what's the next step of your research? What do you want? Do you want to standardize the field of health diplomacy, or like to present some kind of training programs or some kind of guidelines of how it's practiced? And so what next step? You want to present it through the EU or through ministries of foreign affairs, or my question is, what the next step of health diplomacy through your research and through your projects?
So the next project is to establish master for the practicing health diplomacy, so that everybody who wants to practice health diplomacy or are already diplomat but doesn't have enough practicing in the health diplomacy, I want to with my colleagues to establish this unit for the training of health diplomacy. And that will be for that part will be important, this outcome of this research, because what we can see now, and we still need to some data from the research, but up to now we can see that there's a shortage, and that every participant who was there engaged, that they want more specific training in health diplomacy, and that they didn't have good preparedness for the practice health diplomacy. So they took only the diplomatic school, and some of the experts opinions from their ministries of health. But in the end, definitely we need this. That we need a very important master of the for the practicing healthcare diplomacy and global health diplomacy.
Thank you. So the bottom line, what's the impact that more efficient health diplomacy will make? Does it save money? Does it actually save lives? So like in example, you can maybe give me an example of a countries that have better health diplomacy, less death, or so what's the impact that we will have?
That is a very good question. The impact is absolutely to save lives, because in the history, HIV, Ebola shows absolutely many deaths, what maybe we could prevent in some way. And that is why is the topic that has outcome, what is the absolutely top level, high level, and there is absolutely no discussion about that. What is the priority now? It's to save lives and to protect people. And what is a second outcome is to protect the patients as a fundamental human rights. And we have, and we can see the some kind of discrimination in within countries. I can see some difference, and this is absolutely what health diplomacy need to resolve, and that need to be impact of all this work to resolve discrimination. For example, we have a waiting list in some countries for magnetic resonance 3 years, and this is not anymore waiting list. This patient cannot access to the healthcare system, and then need to go to some another country to get access to the healthcare. And there is always a problematic reimbursement process and everything. And so that is also impact what we need to stop discrimination and respect the deadlines and everything what need to be not same, because we have countries it's not it's of course about money, because we don't have every country with the same outcome, but in the high level, we absolutely need to think about to ensure that every patient has access to the healthcare without discrimination, and we need to cover definitely the people who are poor, who are also we have immigrants, and we need to think about all people, not only rich people, about absolutely all people. We know also the situation in Africa, especially with Ebola and everything, that there is always a question about money. So that is some of impact what we need to think about that and change, because there is definitely a space to change something. I cannot accept that in my career, I cannot accept that the things cannot be changed. So that is also one thing. I always think if you have a will to change something, to do something, then you can start right away. Not wait tomorrow, not wait some another day. If you have a will, if you have some idea to that you can do something and change something right away, do right away.
Thank you, Jasna. Thank you. It's wonderful to see how you're passionate about the work you're doing and the impact that you're bringing to this field, and how you see the value, and also there's a value that you're adding to the world we're living in. So I want you to share any advice. What advice do you have for people like who are now starting to embark a career in international affairs? To what in choosing careers or in choosing jobs or roles or fields that they want to work on, what advice do you give them?
The best advice is to not have a fear about anything. The thematic is absolutely difficult. It's very sensitive. It's everything. But that's why you need to choose this career to be different. You don't need to have a fear about anything. If you doing everything with your knowledge, if you have consultancy with other people who understand better, you need always ask something if you don't understand good, and to be in contact with a lot of people from university and from the foreign affairs. It's good to have these connections, to have all fields in the one, and then you can choose what is the best way to you to take from them. And very simple, you can take everything what is the best from every part, from every person, from every country. When I'm doing something, I always take the best from all country. I check what they do the best, and then I take from everybody or every institution best, and then I try to comply all in one, to take a picture of what can be some not ideal, but what I want to be, that is ideal. So that is absolutely don't have a fear. Just you need to be ready for the challenges, and this is a new field, and we definitely need experts in this area. So absolutely encourage all the people to join in health diplomacy. Maybe they have some participant, maybe have some different look, and maybe it will be useful to see what they think about that in the future, and to change experience, because when you change experience with the other people, then you start to have another idea. That is what I'm talking. All the time, the health diplomacy is a process. Diplomacy in the general, that is a process never stops. So it's not unusual, for example, that I have my minds in the late of the night. So I wake up and I wrote on the paper what I need to do tomorrow, because it's like that. If you take that is your life, it's really interesting. It's not something what I think, especially health diplomacy is not. It cannot be only job. So you need to enjoy with that.
Thank you, thank you. I really enjoyed your presentation and talking to you about the field. I'm really enlightened about this field, and I hope that a lot of people who are joining us today to think about health diplomacy and one of the career paths they may choose. This brings a lot of value. It has a lot of impact on a noble also field that you can join when saving lives and also getting in a field that is with a real value to this world and to your community. So I would like to thank again Jasna Karacic, Head of Patients' Rights Unit of UNESCO, Chair at Bioethics and Health of Diplomacy Expert, International Council of Patient Ombudsman. Thank you for joining us today. It was a pleasure and an honor to have you. We will be going now into a break for around 15 minutes, and by 12 o'clock, we'll be back at 12 o'clock GMT, London time, and we will have a session on career in think tanks, and we'll have two representatives from Chatham House in London and one representative from European Council of Foreign Affairs. So I'll see you in around 13 minutes by 12 o'clock, and we'll have the next session. Thank you.